there shouldn't be a cost to a human life. There should be no price tag. So, yeah.
Today is the second anniversary of the Health Care Act, the Affordable Health Care Law, and that brought many of us coverage that we didn't have before. We now have the right to seek preventative care, and we have rights as women to be treated the same as a man does without paying twice as much in some cases for our insurance. That's really important to us women. It is so great that now, as I'm caring for these sick infants, I will be able to talk about the infants and the families and not talk about how they're going to pay the bill. Many parents are anguished in the worst time in their entire life because they don't know how in the world they'll ever afford this. They know that their child will have a pre-existing condition. That is very, very scary if you know you have a lifelong illness that's going to follow you.
No, having traveled around the country, is real stories from people who have already made connections with the law are the most powerful voices to talk about the Affordable Care Act.
I truly believe my daughter is alive today as a result of it. My daughter is 25 years old. She suffers from an invisible illness called dysautonomia and postural orthostatic tachycardia. She was an active child, but fought for years to be diagnosed, and I should say, and she has an underlying heart condition. She spent years trying to find out what was wrong with her. At the end, Julie was blacking out on a regular basis. Concussions, missing teeth, bruises. I worried every day that I might come home when she didn't answer the phone and find her on the floor. Julie wanted to be independent so badly, and her insurance was due to end with my company. Julie had made a choice of not wanting to be a burden on us anymore. That she was going to take the path to go on her own. She knew she would be denied insurance due to pre-existing conditions, but she was willing to take the risk to be off of her insurance, to get denied, and then, you know, try to get help from the state of Minnesota. Well, as a result of the Affordable Care Act passing, Julie was able to stay on my insurance. Not having pre-existing conditions anymore for Julie has restored to her and to our family is dignity. Mm-hmm. The quality or state of being worthy of esteem or respect. And that her financial contributions to society weren't a measure of her worthiness of being treated and getting the help she needed to save her life.
I was born with a rare congenital disease called Toxoplasmosis, and it's a parasitic disease that's rather rare in terms of being born with it, so congenitally. And I had my first brain surgery when I was 10 months old, so I was operated on at Children's Hospital, and I was in the ICU, the NICU. When I was 17, I lost my vision, started to lose my vision in my left eye due to some side effects of my disease. And also that same year I had my first shunt replacement surgery, so I had never experienced what shunt failure was like. Well, I have a very serious pre-existing condition that I'll have for the rest of my life. It's a chronic illness, and I have a long road ahead of me in terms of what could happen. So with the implementation of the law, I can stay on my parents' plan, this is my mother, until I'm 26, which is a huge relief because facing that uncertainty is extremely scary.
We've seen premiums skyrocket, and it's almost become now, with ourselves as aging parents, we see every 5 years an increase, we see every year an increase, and it's just almost become unsustainable for our business. Our business is at risk, not only from recession, but also because of health care.
I said, you know, I feel something, you know, in my left breast. Maybe you should look at that. And the next day I was told that I had stage 3 breast cancer. From there I really found out a lot about health insurance. I have had a couple of re-diagnoses. I had my liver taken, or a third of my liver was removed this last July. And I have been on chemotherapy pretty much on and off for the last 11 years. And in this time, I have been fortunate where I was able to be on COBRA insurance through my employer. But my company here in Minneapolis was sold, and from that they had a new insurance plan, and I was told this last September that I would be kicked off my COBRA insurance. And I had basically 4 months to figure out what I was going to do when it ended December 31st of this year. So I frantically thought, you know, I have a pre-existing condition, who's going to take me? I need to figure this out. Fortunately, I was able to get onto the Minnesota Comprehensive High-Risk Pool, and I'll be on that now until July, when I can get onto Medicaid. With this new law, it gives me freedom to really get back out into the community, fight this disease, beat it, and then, you know, do what I want to do, and give me the options that I need to feel like I'm going to make a contribution, you know, to society.
What we have right now are about 52,000 young people in Minnesota who are on their parents' policies because of the ability to include under 26-year-olds on a family plan. Those are kids who did not have insurance 2 years ago. We have 2.5 million of them around the country. We know that there are about 5 million seniors around the country who are already saving money from the closing of the donut hole. If you think about women, we're the most likely to be uninsured and underinsured. We pay more. The Women's Law Center just said it costs women $1 billion a year in discriminatory payment charges. We pay a woman who doesn't smoke often pays more than a man who does smoke for exactly the same coverage. And much of that coverage doesn't cover women's health needs. That will change in August. Pregnancy is regarded as a pre-existing health condition. Being a victim of domestic violence is a pre-existing condition.
We all know people with pre-existing conditions who now, starting in 2014, no American can be turned down because they have a pre-existing condition. Many seniors who are just living completely on Social Security would have to choose between their pharmaceuticals and food, are now being able to have both. And that's because this donut hole is closing, 50% on name brand prescription drugs, and that will be closed by 2020. This will bring down the deficit, This is going to create jobs. This is going to help small businesses.
Last week, the Commonwealth Fund named St. Paul as the best overall healthcare system in the nation. 4 Minnesota communities were among the ranking systems. I've got my notes here, so I keep them in order. Rochester was number 3, Minneapolis number 4, St. Cloud was number 7. In Minnesota, women and their families are taking advantage of the patient protections in the Affordable Care Act. Because of the Affordable Care Act, families are in charge of their health, not insurance companies, and we think that that's a good thing. When we put families first, when we put health care first, our nation's stronger, our family's stronger, because we're all healthier.
I want to thank you for your department has been just tremendously supportive and encouraging of our putting Minnesota back in the forefront, and thank you very much for that. The early opt-in for Medicaid, which is possible under the Affordable Care Act, has been over 90,000 Minnesotans are now have coverage who didn't before, and I've lost count of the number of people who have come up to me and said, you know, because of that, I've been able to have heart surgery to save my life.
First, there's a whole new set of rules for companies, not just that they can't cherry pick anymore. They can't just take healthy people and kick out sick people. They can't drop people because of a mistake. But the policies themselves have to cover a set of benefits, essential health benefits, because a lot of people have insurance that really doesn't cover anything.
My colleagues kept saying, it's big government, it's big government, it's big government. You know, this is not big government. We still have a free market. This is about not big government. This is about insurance companies not dictating to doctors doctors and patients what will and will not be covered. There will be a open, transparent dialogue that will take place in the exchange so that you know what's being covered.
When we talk about the colleagues in the House of Representatives who want to blow up Medicare, give people a voucher basically and go shop for your insurance on your own with an insurance company, we're really talking about kind of blowing up a woman's health care program into her senior years.
We see it every day, that our society is a great society in America. We need to take care of those who cannot care for themselves, and we need to allow them the dignity to work and pay for their insurance.